Good afternoon, Chair, members. Thank you for having me join you today. I'm Karen Larsen. I'm the CEO for the Steinberg Institute. As a therapist, I served the underserved population, undocumented, unhoused population for more than 20 years in community clinics and nonprofit settings. And just prior to joining the Steinberg Institute, I was the Health and Human Services Agency Director for Yolo County, which was an integrated agency with social services, public health, and behavioral health services all under one agency. The Steinberg Institute was founded by Mayor and co-author of MHSA, Darrell Steinberg, and we're a nonprofit public policy agency dedicated to transforming the systems of care for mental health and substance use in California. And since our founding, we've really tried to serve as stewards of the MHSA. The MHSA was born out of two pieces of legislation, AB 34 and AB 2034. They were authored by then Assemblymember Steinberg, and these bills really established the whatever it takes approach to care for people experiencing homelessness with significant behavioral health conditions. And they had great outcomes. They reduced homelessness, incarceration, and hospitalization dramatically. So in 2004, based on that premise, the voters overwhelmingly approved the MHSA. To scale this model statewide, and with the promise of ending homelessness amongst those with behavioral health conditions. Nearly 20 years later, without proper state oversight and guidance, we've strayed from the MHSA's original intent of focusing on serious behavioral health conditions and homelessness. Current MHSA rules require the majority of funds for services to be used for this whatever it takes approach. But out of the 10 California counties with the highest homeless population, only Orange County is following the MHSA's spending standards. Between 2019 and 2022, Orange County saw a 17% drop in people experiencing homelessness, while the rest of the state saw homelessness rates continue to rise. This isn't a coincidence. Over the last decade, funding in our behavioral health system has more than doubled, but the rates for those receiving care haven't improved. At the same time, we've seen homelessness, incarceration, and hospitalization for those living with significant behavioral health conditions skyrocket. In our recent analysis published earlier this month, we found SB 326 to be not only in keeping with the original vision of the MHSA, but an urgent and necessary plan to care for our most vulnerable. First, SB 326 sets critical priorities to fulfill the intention of the MHSA. Until now, California has not set clear statewide priorities for behavioral health, spending in general, or for the MHSA. SB 326 focuses the nearly $4 billion in MHSA revenue to target the most intractable issue of our time, homelessness amongst those with serious behavioral health conditions. At the same time, SB 326 preserves critical early intervention dollars and set-asides for children and youth. Second, the bill doubles down on outcomes and accountability. Failure to establish standard metrics and properly track, evaluate, and improve outcomes since the passage of the MHSA has been one of the biggest failings of the current act. Our systems must be able to account for improving the lives of those living with the most significant behavioral health conditions, especially when it comes to homelessness, incarceration, and hospitalization. Third, SB 326 adapts the MHSA to a new funding landscape. California has invested billions of dollars in a complete overhaul of our statewide behavioral health network via investments in youth mental health, commercial insurance coverage, desperately needed mental health infrastructure, and a first-in-the-nation expansion of Medi-Cal. SB 326 accounts for how these new investments interact with the MHSA to ensure that we are being the best stewards of the public dollar and meeting the needs of Californians. We honor the hard work and dedication of our partners at the county and provider level and acknowledge the tremendous challenges they are facing in terms of workforce and competing priorities. We believe that we must all work together to focus resources and services so that California can achieve the greatness we are capable of in caring for those living with the most significant behavioral health conditions facing the worst possible outcomes. We believe SB 326 will do just that. We are grateful for the unparalleled leadership from Governor Newsom and Senator Eggman and are proud to support SB 326. The Steinberg Institute is committed to working with the legislature, Governor Newsom, and our partners to seize this moment and realize the vision of the MHSA. Thank you.